We have a health alert for you tonight. Cases of whooping cough on the rise in Galveston County, mirroring a national trend.
The bacterial infection is highly contagious and if not treated, can easily spread. Rekha Mudaraj has more on the symptoms to look out for and why getting a booster shot is so critical.
Len and Mia, the illness starts off with symptoms similar to a terrible cold, a runny nose, fever, and mild cough, which typically go away within a week. But after that, a significant number of people develop a horrible cough that can last for months. A person will cough, 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 and then they gasp for air. And that sound is the whoop. That's where the name for this bacterial respiratory infection comes from. And it can be very serious or even fatal for babies, young kids, and older adults. It's also highly contagious. The CDC is reporting an alarming increase in the number of whooping cough cases since 2014 nationwide. By this time last year, almost 4,000 cases were reported in the U.S. This year, more than 17,500 cases have been reported so far. Dr. Philip Kaiser with the Galveston County Health District says 8 cases have been reported there among its 350,000 residents.
Right now, those 8 cases really exist in 2 clusters, 2 families. And so we've been able to contain it among that group of people. And that's by a combination of vaccinating people and treating people. And so we're not seeing more spread. I think we know, again, let's go back to our COVID experience. We know when it really starts getting out of control. And that's when, you think, okay, it's localized, and then you get more cases and the clusters just keep growing. The nice thing is now is we have good technology that we can track people, we can map where they are and see where the cases are spreading.
Whooping cough, also called whooping cough, is treatable with a round of antibiotics if it's caught in the early stages. It's also completely preventable. People are encouraged to get their booster or Tdap shot, especially pregnant women, so immunity can be passed along to their child, and older adults like grandparents who are around young children. Most healthcare providers and even pharmacies offer the recommended vaccines. In the newsroom, I'm Rekha Mudaraj.
Good to know the signs and symptoms. Rekha, thank you.
David Paul has